solution was actually developed after a meeting I took with United Healthcare when I was back in Connecticut. And the discussion was, how do you know what makes your users tick, period? And are they just downloading an app or buying a device for 1 week and then adding it to their stock of hand-me-downs for the family and friends? So I definitely have my share of those, and I think all of our goals is not to have that. We hear the word design, long-term use, gamification, engagement. These are all, obviously key words that we keep hearing, and they all sound awfully important, but unless we start sharing some real successes and some real failures around adoption, many of us are continuing to reinvent the wheel. So welcome to Key Triggers. And you're going to hear from incredible speakers working on the front lines who are continuously accelerating adoption and improving customers' experience with digital health. So I'm going to hand it over to them, but I'm going to first introduce the person who'll be leading this session, Denise Yhon. She's the president and consulting partner of her own Denise Yhon Inc. And fun fact about her, she counts dancing with a professional ballet company, hiking Mount Kilimanjaro, and flying a helicopter as some of her greatest life experiences so far. Thank you.
You try to make your intros make you sound like a really fascinating person, but I have to confess those are probably the only 3 things that you really need to know about me. So this session is about how you ensure that your digital health product or service is not just a nice to have, but is really a have to have. And it's really an important topic, as Jill was explaining. According to research by the healthcare and pharmaceutical market research company Manhattan Research, only 26% of US adults have used their mobile phones for health information or tools in the past 12 months. And there are numbers that are similar to that from other studies. What's interesting is, according to PR agency Rudolph Finn, only 16% of people regularly use those health apps. And they actually surveyed people and asked, well, why don't you regularly use your app? And interesting, 27% said they didn't have a need to access health-related apps. 26% said they preferred to talk to a doctor in person. 11% were concerned about sharing private information. 9% said they didn't find the apps helpful. 7% didn't know they were even available. So there are definitely some major roadblocks to adoption, and that's just on the consumer mobile app part of the business. Adoption of digital health tools and systems by caregivers and healthcare organizations remains at a lower level and a slower pace than I think we all would like. And I think that's because there are significant organizational, technology, financial, regulatory, and cultural barriers. So we've assembled a panel of experts to share their insights on the challenges of adoption, as well as how they have overcome some of those challenges, and the way that they're addressing those with their products and services. They represent a wide range of perspectives, which I think will make for a very interesting discussion. And so let's start with each one of them introducing themselves. And I will start with Paul Prescott from Arogo.
Okay. So yeah, my name is Paul Prescott. I'm the Chief Technology Officer of Ayogo. And what we do is make games that motivate and educate people about mostly chronic diseases, type 2 diabetes, type 1 diabetes, obesity are some examples, but also increasingly diseases like cystic fibrosis and MS that are not quite as mainstream. And so everything we do is around engagement, so we consider ourselves almost, in a sense, on the front line. It's our job to get people to think about, in some sense, confront their condition, but in a safe and in fun environment. So you can see over here one of our games with all the little monsters and pets and so forth. So this is a game for children with type 1 diabetes. And where the idea came for us is that diabetes is sort of like a monster, especially to a child. It's frightening. But if you take care of it every day, as you can take care of these little monsters, then it's not as big of a deal. So this game is tied to blood glucose checking, and it gives the child a little bit of pleasure in the process that would otherwise be very painful. And the reaction we get is really very moving. I told an anecdote the other night at dinner about a little boy who said to us, my sister really likes your game, but she is not allowed to play because she doesn't have diabetes.
Wow.
So we're taking that thing that they are trying to put out of the back of their mind and not think about, and saying, let's think about it a little bit every day, and check your blood sugar. It won't be as painful as in the past. So what we do is not just add points and badges to pedometers. That's sort of, in a sense, the first wave of gamification, but we come out of the game industry. We're in Vancouver, BC. We're Electronic Arts. Used to have a very large place, but all of the big studios are getting smaller and smaller, and the great talent there are migrating to smaller studios like ours. And so, at the top we have a game that's a spy theme. So, and that one's actually about educating people about prostate cancer. Below we have some games relating to diabetes, and you can see that these are kind of the main game philosophies, the main game things that separate us from just adding points and badges to some sort of health system.
Terrific. All right, thanks for introducing your company to us. We next have Chris Bergstrom from, ta-da, WellDoc. Go ahead.
Thanks, Denise. WellDoc, if you're not familiar, we're a clinical and behavioral science company focused on engaging patients and enhancing outcomes. We primarily do that by providing real-time, personalized, contextually relevant coaching and education to patients. It's all automated. It's sort of like the Google of healthcare. If you put an information in, you're going to get immediate, real-time feedback on what it is that you're putting data in on. And sometimes we also provide clinical decision support to providers, and sometimes enterprise tools to disease management type organizations. We're very happy to be here. As most of you know from yesterday, we announced the launch of our flagship product, which is the world's first mobile prescription therapy. It's FDA cleared, and you can get it prescribed to you from your doctor, and it's reimbursed by your insurance company.
Very cool. Tom Hall from United Healthcare.
Good afternoon. As was just said, my name is Tom Paul. I'm the Chief Consumer Officer for United Healthcare. Pleasure to be here and talk with you this afternoon. I thought I'd start just by making sure people know who United Healthcare is and give you a little bit of background. United Healthcare is an organization that provides health benefits and services to individuals both within the U.S. and within South America as well. We serve about 40 million individuals. I do a variety of breakdowns of those individuals. We have our youngest members probably minutes old. Our oldest member turns 114 in August. So we have quite an age range of individuals that we serve. We have probably equal distribution across all the generations, Gen Z, Gen Y, Gen X, Boomer, and Silent Generation, and so serve a variety of populations by those age categories. We also serve based on different payer systems. So whether those relationships are enabled through Medicare, through Medicaid, through an employer, direct to individual, or through the military. So have the ability to take and nuance those relationships based on the payer system in which they exist in. My job as the consumer officer is really to look across all of those relationships and ensure that as an organization we are doing everything that we can to take an outside-in perspective about how we nurture that relationship and enable us to fulfill our mission around helping people live healthier lives, to take and enhance our engagement strategies, whether that be through paper, through call, or through digital, and create a culture within our organization that really shows that consumer centricity and enables us to, again, build and nurture the relationships we have with those 40 million individuals. So,
Great.
Great, thank you. And then last we have Vishal Dubey from Dakadu.
Thank you. Hello, I'm Vishal Dubey with Dakadu. And Dakadu is, from an introduction perspective, Dakadu is a lifestyle navigation company. And we focus on individuals to improve their health and wellness through tracking and monitoring in real time. And for that, we have developed a simple health score. We call it simple, but it's based on very complex algorithms, based on many years of clinical data, and it takes into account who you are, what you do, and how you live. So how you live is the part that most people can impact. And there we include things like your activity, your nutrition, your sleep, and your stress levels. And we give people feedback in real time so that they can make a difference. We're really excited about the health score part because it's a simple number, really a number between 0 and 1,000, which tells you how you're doing it, and not worrying about all these complex numbers that are being thrown at you, your heart rate, your blood pressure, all of those things, and how to make sense out of it. Company is based out of Zurich, and we formed the company in 2011, and last year we launched in US, and we have gotten a lot of traction from European clients in terms of adoption. So we target to businesses like insurance companies and large employers who are interested in employee wellness or their constituent wellness. So we are working with some of the largest providers in US, like Europe. For example, Nuffield Health in UK, and AOK, they're an insurance company out of Germany, and Deutsche Telekom. And it's important to say all this because we have gotten real traction, we have good paying subscribers, and we are seeing very positive results. Our platform is really a white label solution for big companies, and it's a fully integrated device agnostic platform with the principles of gaming and social networking and wellness and psychology built in, so that we can motivate people and help them with a sustained lifestyle change. So that's the introduction to Dakadu.
All right, great. And just so you all know, when Rafi, Jill, and I were putting the session together, we decided rather than having formal presentations, we really would do this all by discussion. So I have quite a few questions that I'll be asking the panelists, and then there'll definitely be a time for you to ask questions as well. So be prepared, and we'll kind of jump into that at the appropriate point. But I do want to start where you left off, Vishal, and talk a little bit more about the different approaches that Dakadu does or uses, because I think that different means are going to work for different populations. And so I'd like you to kind of break down a little bit more about how are you achieving real behavior change in different ways? What are the different techniques that you're using?
Sure. So we started off looking at health and wellness space, and we all know that it's complex and it's based on fear. So our goal was to make it simple for consumers and make it fun. So for the simple part, we developed this health score that is really a simple number. You can obviously drill down on it, but it gives you a simple number on how you're doing at any point of time. On the fun aspect, we assembled a team of behavior scientists and gaming experts and got them together to see what takes people in other aspects of life that we can make it work in health and wellness space. If you have to make it fun, it has to be engaging. You have to be passionate about it, and it has to be continuous, right? So we launched a project called Project Life, which is based on identifying the passion that people have, identifying what motivates them, so positive motivation, and then continuous engagement. From that perspective, we have identified few techniques that we are working on, and we have incorporated in our product. So one is the social and the gaming aspects. So people are more likely to stick to their goals when they make it public, and then when they share it with other people. So that's the social aspect. and not only with other people, but also their care providers, so that they can get constant feedback on that. On the gaming side, we are not doing the full gaming, but using principles of gaming such as achievements. So you as an individual can compete with yourself. You can set a goal and achieve that goal and feel good about it. And we have this virtual avatar built into the platform that constantly guides people in terms of defining the goals and also modifying the goals. So it's sort of taking those baby steps and not giving you a goal that you can't achieve and you give up, right? So the other aspect we use is continuous engagement through notifications and feedback. So the health score is a continuous feedback mechanism, but we also have a health band, for example, that allows people to get notified in real time, either through their provider or from the platform or through their network, and they can be constantly engaged. It's not something that you're carrying. If you don't have your phone, you still have your band. So we are focusing on, that takes me to the other point, we are focusing on an omni-channel strategy. So we're not about a mobile app or a website or a connected device. We want to make it a continuous experience so that we are reaching our users wherever they go, whatever they're doing, and on their terms. So make it personalized, make it simple. We do not want to make it complex.
Yeah, for sure. Simplicity. I also heard you talk about fun, then tapping into consumers' needs for achievement, and then I love this being always on, kind of everywhere, so that it's seamless for the user. What about other folks on the panel? How are you? What are some of the techniques or approaches you've been using to prompt behavior change, and what have been effective, and why is that the case? Anybody?
You know, I'd say at WellDoc, our philosophy is more about intrinsic rewards than extrinsic rewards, so it should be an interesting discussion. We think if we provide you something that you intrinsically believe is of value to you, you're going to come back for more. And I mean, I can get almost anyone in the room to do something for a certain amount of money right now, right? And you can do it one time, and if I keep giving you $100, you might keep doing it. What we're looking for is the opposite. You know, what makes myself go into Facebook 50 times a day and into Twitter 50 times a day and into my Ameritrade account 50 times a day? I mean, and if you look at it, it's I think there's three really key things. It's personalized to me. It's contextually relevant to things that I care about in the moment that I care about it in real time. You know, so when I go to Facebook, it's my friends talking about the basketball game, you know, that I just watched, or you know, Ameritrade is, you know, how's my money doing today, and do I need to grab a different stock? And Twitter, you know, what's the latest headline from the DigiHealth conference? And similarly, when we're providing coaching and feedback to patients, it's not population based. It's not about what happened to you 10 weeks ago. It's about you, your medication regimen, your medical history, and this moment in time where your glucose is here and you've eaten 40 carbs, and here's what you should do now. And we found that to be the most engaging, and then leading to behavior change. And it's through a stepwise of taking data, turning it into information, knowledge that leads to actions, and then ultimately outcomes.
We've somewhat followed, again, similar to what others have said, but basic behavioral, kind of steps with creating that awareness around why it is that it's important to you as an individual to be involved at this point in time. What we've seen from consumer research would say that a lot of the activities that, from a health perspective, we like individuals to do, really the long-term payoff is the goal. So better wellness, better health today will lead to a better outcome, but it's not going to be tomorrow. It's going to be something maybe years out. So it's hard to get that connection, and a lot of research would show that people don't associate their activities of today with tomorrow's outcomes when it comes directly to health.
Yes.
So creating that awareness about why you need to connect those is really important, and then giving the skills in order for, once you've recognized and acknowledged that smoking is bad for me, what are the skills that enable me to do something about that? And then the motivation that comes as a part of that. And so those behavioral characteristics we build into our programs, and we've actually seen different adoption rates by when you miss one of those characteristics in that behavioral wheel, so to speak, as we look at adoption and engagement.
Interesting. Yes, Paul.
Yeah, so I actually wanted to respond to Chris's well thought out question about intrinsic versus extrinsic motivation, and this is something that we think about literally every day. So it's a really important question. So I guess for those that aren't into the psychology of behavioral change, intrinsic motivation is about sort of what's inside you, your own goals, and extrinsic motivation is sort of, if you take it to an extreme, it's sort of, a Pavlov's dog ring a bell and someone salivates type situation. So it's absolutely important to actually find the intersection of those two. So we do work with behavioral psychologists to ensure that we do that. And so I'll give an example of one game. We're just in usability test right now. There's actually a third-party lab that's testing it right now, and it's going on at the same time as the conference. So I'm running up and down to my hotel room to listen in on the actual test live, and it's really interesting to see how the two reinforce each other. So what it is we need them to do in order to consume all of the complex information related to type 2 diabetes is they have to show up every day to learn a little bit, because we're not dumping a huge amounts of text on them all at once. What we're going to say is, we just need you to come back every day, and we're going to teach you one extra thing. We're going to check in with you, how you're doing with your commitments to the goals that you yourself had set, and we're going to track your progress and habit change. So the very first thing we have to do is get them back every day, and that's where the extrinsic motivation can be a big help. When someone says, yeah, I'm looking forward to that 10 minutes a day with that game that's also about diabetes, then we can build a sort of a scaffolding around their intrinsic motivation. And in this particular game, the very first task you're asked to do in the game is to declare for the whole community, why is it that you want to take control of diabetes? And it's really great to, again, watching these videos, people piping in things like, I need to take control of my diabetes so I can live long and have children, or so that I'll live long for my existing children, or just because I see myself in the future being more healthy and active and that sort of thing. So I can travel. The game's theme is travel, and they want to be able to travel themselves, but have found that their type 2 diabetes has made them too tired to travel. So those are all the sorts of things that they type in, and then other people in the community reinforce it. So it's absolutely about both of those things. Why do you want to do it? That intrinsic motivation, but I'm going to make it painless for you every day to just do that one little habit. And that's based a lot on the researcher B.J. Fogg's Tiny Habits philosophy. He's one of our advisors.
Great, great. And so we'll pick up with the next question for you, Paul. When we spoke earlier, you had talked about the partnerships that you've engaged with, and so I'm curious, how have you used partnerships to increase adoption and to kind of sustain change for people?
Yeah. So one of the complex things about our business is that we always do work with lots of partners. So, for example, the very first project we did, it involved us, bringing the engagement, game design, and so forth. It involved the Joslin Diabetes Center at Harvard, the world leaders in diabetes education and diabetes research. It involved Boehringer Ingelheim, a pharmaceutical company, and it involved the Diabetes Hands Foundation. And each of those people bring something else to it. So obviously we bring the engagement. The Joslin, they bring the science and the clinical results and the capacity to measure clinical results. And the pharmaceutical company, well, they bring the money, but they also bring the relationships. They have public relations organizations that can get us onto television shows and websites and so forth. So that's part of the reach as well for them. They want to be seen to be doing good in the world, And it doesn't hurt that, part of what is good diabetes care is taking your medicine is actually a really important part of good diabetes care. So it's in their interest as well. And then the Diabetes Hands Foundation was an important part of it as well. They're a nonprofit. They're trusted. People trust them when they recommend something. They say, yes, this is sponsored by a pharmaceutical company, but it's not just going to push drugs on you. It's about medicine and diet and exercise and psychology and empowerment. So going through that trusted channel is also an important aspect of it, and that's a big part of how we do it. And I'm really excited about the growth of social media around these conditions. I see those currently small nonprofits, social media nonprofits, becoming very large over time and probably taking a lot of the mind share away from the very established, ADAs and that sort of thing. Because people want to connect. They don't want to go to a site with a bunch of just textual information and a request to donate. They want to connect. And those, that's what we do in our games, and that's what the nonprofits that we work with do. And so there's a great fit there.
Right, it seems like it's mutually beneficial for the parties that are involved in the partnership and then ultimately for the user.
Yeah, and for the whole society. I mean, this is the really exciting thing about this, where we work, is that everybody's interests are aligned. The patient wants to get better, the employer wants them to be better, the insurance company wants them to be better, the pharmaceutical vendor wants them to take their medicine, which they're supposed to, the doctor wants them to take their medicine, the diabetes educator, everybody's interests are aligned. So we have a lot of different ways to get to the patient.
Right.
We just have to find, for the particular condition and the particular patient, who is the trusted recommender, and of course, the patient's friends are another possible
yes.
recommender.
How about the other gentleman, comments about partnerships or relationships and how they've helped?
Sure, we've, again, similar to what was said, really identifying where there's that synergistic opportunity between two organizations. I can use an example of nutrition or good eating, and how you can have an impact on that. And so we partnered on one side of the bookend with Sesame Street, which was a way in which we could take the expertise that we had around good nutrition and deploy it within a population in which health insurance probably doesn't resonate. And so did a partnership with Sesame Street and have done a very focused campaign and tools of engagement around good eating, both over and under, as well as exercise associated with that, where their brand, their expertise of that population really benefited us, and our expertise around the health and habits really, when brought together, did a good partnership. On the other end of the bookend, we partner with AARP because nutrition is also a significant challenge within the senior population, with over 9 million seniors who do not have access to food or the right food, and challenges again with obesity within that population as well. And again, the marriage of AARP and United together brought a great opportunity within both to create that awareness and that acceptance of a change is good and something needs to be acknowledged and work. So those are two examples on bookend populations that have really worked for us.
Yeah, so in terms of partnerships, I think in healthcare, it's an ecosystem, and it's so horizontal that it touches almost every aspect of our life. So we partner with directly healthcare-focused companies, like insurance companies or wellness providers, but also, for example, Deutsche Telekom. It's a telecom provider, but we are working with them to roll out a value add for their consumers, so that it creates sustainability and also stickiness for them. So it's good for everybody. That's one example. On the backend side, on the platform side, we totally rely on our partners to come up with devices that we can integrate, because as many data inputs we have, it's more beneficial for the end user and makes our platform more intelligent and more user-friendly.
Great. Chris, I wanted to talk with you a little bit about different customers or different stakeholder groups and different customers and different channels. And when we had our prep call, you had, I think, a really good way of thinking about how you get all of these different parties aligned and how you think about each one differently. And so I was hoping you could break that down for folks.
Yeah, sure. I mean, I'm just personally very passionate about the business model aspect and the commercial deployment of products. So if we work from the premise that you've built a product that is a good product, because if you haven't, it doesn't really matter how you line up your business model and channel, but if you have a good product, I think you have to align 5 things in this space to 2 things. The 2 things are your user and your payer. Sometimes they're the same person or thing, and sometimes they're different. But if you can align either your value proposition to those 2 entities, the evidence that your value proposition actually is real, a channel that allows for distribution of that product to the end user, and a business model that works for that payer, and then in this case, a regulatory strategy that legally allows you to do whatever it is that you're trying to accomplish. So I think if you can take value proposition, evidence, channel, business model, and regulatory strategy and align them to your user and your payer, then you can actually have a viable business, and assuming you have a product. And I see a lot of times where I think that falls apart, and people are maybe getting 4 of the 5 right, but they don't get the 5th right, or they get 2 out of the 3, and it really doesn't work well unless you get them all aligned. And it can change over time, so this is a dynamic situation. But to bring it to life, so at WellDoc we have currently have 3 different product lines and business models. One is in medication adherence. And so here we have a product that helps people adhere to specific therapies. And the value proposition for the patient is that they can feel better. And we go through a channel partner of a pharma company because their value proposition is selling more pills. And the evidence that we have to bring to the table is that we actually improve days on therapy or number of scripts filled. And when you have all that aligned, we know who's paying for it, we know who's distributing it, the pharma company, we know who's using it, we know there's a value proposition for both, and we're able to actually deploy and operate a product. Another example would be in disease management, where we might have a value proposition that's for engagement or workflow efficiency or improving enrollment. And then we have to demonstrate evidence that we actually can improve those metrics, and we deploy through the disease management companies, and the users are probably still the patients. And so the payer and the user are different. In the business model, we align to the way they're used to paying for things, which is generally a PMPM or PUPM business model. So it's just aligning those. And then in the last market, the one we talked a lot about yesterday, in the provider market, the value proposition is outcomes and quality of care. And evidence to support that is, the gold standard is an RCT. And so, have you demonstrated outcomes in a peer-reviewed published RCT, or hopefully multiple of them? And then, can you deploy, to go through a provider channel, you have to be in the physician's office. So do you have feet on the street? Are you in there? Do you have a relationship one-on-one with that doctor? And then are you supplementing that with direct-to-consumer advertising? Do you have a relationship with the patients that are seeing the doctor so you can get the push-pull? And then in the case of the insurance companies paying for it, they only have a couple ways that they pay for things. CPT codes and HCPCS codes and NDC codes, and so if you have a prescription product, you probably want to be able to fit in and go through their pharmacy benefit structure. And so and if you look at those 3 that I described, if I started mixing and matching pieces into the wrong ones, it falls apart. And we tried, so we had some mistakes along the way.
Well, it also seems like you can't just blob it all together and kind of just think about your business as one thing, but really you're breaking down your business into very discrete chunks and really examining each one specifically, and even within that, the specific value prop evidence really being that requires, I think, a great deal of discipline and kind of strategic thinking that goes into your go-to-market strategy and really your whole development strategy. But it's it's a disciplined process you need to go through.
There is a lot of discipline. There were a number of times where we could have, we were striving, let's say, for the provider market, but we could have gotten to revenue faster by just throwing it more into an adherence market and not going through multiple years of randomized controlled trials and all of the other heavy lifting. But we knew that we needed that evidence. We knew we had to have FDA clearance to be able to, actually help mitigate a disease and deploy it through the provider market. So it takes investors that understand and are aligned to your strategy and some discipline and some luck. And
Sure. Okay. My next question goes to Tom. Selling direct to consumers is kind of a newer thing for United Healthcare, or getting more into it maybe. And so I'm curious if you could talk about the differences in adoption between the consumer market versus the commercial customers that you've been working with, and kind of explain that a little bit.
Yeah, we've actually, from a United Healthcare perspective, we've within the populations that we serve, our Medicare population is probably the best example of where we have been direct to consumer for many years.
Okay.
And the rest of our population is going to change as we go forward because of the change within health reform and in the introduction of exchanges, and there'll be greater decisions made by the consumer not only about who their health insurer is, but how they're going to realize health. And so it's important for us to pay attention to those ways in which we engage and gain adoption through those experiences. And so, there's three kind of examples that come to mind about how, and I'll start with the commercial population, and then I'll go into Medicaid and our Medicare population just to show how we're leveraging that expertise. So we have a program called Personal Rewards, which is really around, again, motivating individuals and creating that awareness around ways in which today's wellness can create better and long-term health objectives. So we've been in this program now for about 3 years. We use our own organization as guinea pigs. So our employees become our testing ground many times in which we introduce programs. We currently have, which we're quite proud of, the adoption rate. We've got over 80% of our employees now actively enrolled in the program, and just under 40% of them getting full value, because we, in essence, give discounts off of the premium of the insurance plan. They get a significant discount off their insurance when they meet their tailored goals around health. And just about 40% of them are realizing full value of that incentive payment that comes with that. When you look at it, 76% of the population in that program are getting regular physician checkups versus about 46% in the general population. If you look at the diabetic subgroup within that population, significantly improved in hemoglobin A1C, retinal exams, creatinine test, et cetera. So we've seen significant improvement, have learned a lot over the 3 years. If I take that now and apply to a Medicaid population, we're predominantly focused there in this program around mothers and kids, and it's really identifying within that 0 to 13-year-old age, and then the mothers that are associated with those children, about how to get gaps in care. And most of the time it's connecting you to care to begin with. It's the very basic of getting you connected to the healthcare system, because they're not connected. We started a program there, mobile enabled, called Community Rewards, and started out though with not great success. We had about a 3% adoption rate. And again, it's all about iteration and finding out where you did well, where you did not do well. We now have that program up to about a 13% adoption rate. We've kind of learned, relaunched, and again, missed the step around creating the awareness of why that's important. Why is it important that you have a primary care physician? Why is it important that I go in and have a physical? What are you trying to ask me to do? And as we did that, created greater awareness. And one of the stats around that program that we're really quite proud of is 45% of the members that now use that program were not through our direct outreach. So they were word of mouth of individuals using the program, told someone else, and now are a part of that program. On the other end, and getting to your partnership question, on the senior side, we partnered with a company called Novu and have created a senior program that we've geared toward a senior population around, again, a health score, and then working with you based on where you're at and creating an action plan, so to speak, that's very personal and tailored to you. If you tell a 70-year-old who may be spending 60% of the time on the couch to go out and walk a mile, you're not going to get much success. But if your first few weeks are about leg raises or arm raises while you're sitting in the couch, you might get motivation. And so
The arm raise,
exactly. So we've tailored that approach and create challenges, community challenges, again via digital experience, and have been overwhelmingly surprised about the adoption rate in a senior population around that. Some of the surprise statistics is the involvement of males. For most of the time, females have a tendency to have a higher level of engagement around health. Here we were seeing a higher participation in primarily overweight males and getting great adoption. At least in our space, to many, this may not sound like a good statistics, but we have 60% of our users that are engaging in that site 1 to 5 times a week. And for us, that's quite an accomplishment.
Yeah.
We have 30% who are actually doing it 3 to 5 times a week. And the other thing that was a bit fascinating for us around this was we do have a point system that we reward with as they accumulate their motivations. And we've gone less from the cash financial to a point system because we find it gets a greater motivation. What was fascinating about this population was how they use the points. The number one way they used the points was through raffle systems, where they could take groupings of their points and buy raffle tickets that would get to a larger experience or a larger reward. And then the second was really around charitable contributions, that they wanted to take their points and give it to a charity of their choice and enable that organization, which was really a great thing. And so we keep learning and reiterating about these, but within each one of our populations have been able to kind of continue advancing that adoption rate.
You know, Tom and I had been talking about how historically they had been doing marketing campaigns direct to consumer in the senior population. We've all seen the AARP United, and probably wasn't relevant to many people in the room, but then you really caught my attention as a consumer maybe about 18 months, where you had this new campaign and people were jogging and had digital health data flowing around them. And I mean, just as in terms of engaging the consumer from a new marketing campaign, it resonated with me as a younger person who's really largely ignored outreach from payers, and as a digital health guy, it was really exciting to see a big company like United actually putting that on the forefront of your marketing campaign.
Yeah, it's been important to really transform that perception of who we really are to the consumer and what role that we can play. And I think often within the health insurance industry, there can be this perception of Big Brother and this perception of not looking out for or supporting the individual. And so we're trying to take that approach that the more simple, personal we can be, and the more we can connect you to the right resources that enable you to realize your own personal health goals, not ours, not your employers, not the government's, but yours, the more successful we are in creating that right relationship.
Great. So consider this a one-question warning, in the sense that I'm going to ask one more question and then I'll open it up so that you all have a chance to ask questions as well, okay? So this question is, I want to skip to one question about customer research. What, if any, research do you do, and what methods are really effective in helping you understand what people's needs are and how to really speak to them so that you can get that kind of adoption? So I'll open, Paul, do you want to start? Okay.
Sure, yeah. Excuse me. This is another example of where working with nonprofits has been really valuable to us. So a good example is the College Diabetes Network. So, there are very specific psychological kind of things going on when a child moves on, becomes an adult, and moves on to the university campus. They're moving away from mom and dad, moving away from their childhood doctor, and it's really easy to get lost in the campus and get caught up in everything that's going on, and not take care of your type 1 diabetes. But they told us that, that there is a subset of the kids there who are willing to take responsibility for each other, to actually connect with each other and say, if you watch out for me, remind me that I should be checking blood sugar, taking insulin, laying off the booze and that sort of thing. then I'll do the same for you. I don't want mom and dad looking over
Right.
my shoulder, but up here I would do that.
Right.
So, those kind of insights that people that are on the ground every day with these target populations can give you, that it's a lot harder to find from outside. So, for example, I'm really excited that I might be able to work with Silas from,
yes.
from the faith community's point of view. Again, that's, we're up in mostly secular Canada. We wouldn't know how to do that.
Right, those heathens up there.
But, yeah, exactly. But working with someone like that would be really
Right.
exciting to us.
Right, good. Other folks about research and consumer?
Yeah,
Oh.
so I can go. Essentially, it depends on what resources you have available to you. For a large company, I was with Kaiser Permanente before Dakadu, and there we used to do massive studies. So there was ethnographic studies where you actually videotape people and see how they are behaving and in actual situations, because a lot of times what they say in surveys is not exactly how they use the product. So those are really helpful. We used to do journey maps there. What would it take for a patient to, let's say, enter the hospital or the clinic and take them through the entire journey, and how your digital assets fit into that. And also there was a 50,000 member panel that regularly would be surveyed. If you have limited resources, I would say you have to rely on feedback, direct feedback from your consumers. So we rely on feedback from our partners. They tell us all the time what they're seeing on the ground. We have feedback channels open on social networks where we can receive feedbacks, and also direct feedback from consumers. So all the ways.
All of the above, yeah.
Yeah, the only thing that I would add, and I agree 100%, and there's, especially from the health side, we can take a lot of cues from, the retail world around research that they do with the consumer. Our key learnings really, regardless of the type of research around that, was a willingness to listen and respond to the research. That we found we tended to have preconceived assumptions or conclusions around things in which we used research to confirm. And I think it's a new opportunity to really be very open-ended about how you do the research, how you ask the question, and most importantly is how you listen to what the research tells you, and then how you change what you do as a result of that research.
Right.
Well, I was going to say, there's so many different market research tools. It's really important to use the right one at the right time. And if you're trying to make feature trade-offs, maybe Khan is a good tool to use. But the two that I really enjoy, enjoy is more the front end and then the back end. So the front end, white space, going in and saying, I believe Steve Jobs is largely right. He says no one can tell you what they want because they don't know what it is because it doesn't exist. But what they can tell you is what their problems are. And so you can go in, what's a good day? What's a bad day? Well, then what'd you do? Why'd you do that? And you can really listen to them and find out, oh my gosh, they might not even be able to literally articulate your problem, but if you listen, you'll hear that problem in there. And they don't even realize that they're wasting 20% of their time doing something because they've become so used to it and numb to it. But so I enjoyed that front white space end. And then especially in these type of products, mobile health, digital health, because they're so digitized and analytical, we can actually see in real time, how are people using this? What are they using? Where do they get stuck? What are they using the most of? And then we can begin to align the usage to the outcomes, and then really put those two pieces together. So in this space, I really enjoy those two bookends.
Right, and to your point, it's not necessarily a lack of data, but it's really, how do you use that data, right? What questions do you have for these panelists?
Other than when's lunch?
I was going to say, you guys are probably getting pretty hungry, right?
It looks like we have a bunch of apples. I can't see people, but I see all the
See
glowing
little
apple.
Apple logos, right?
Yeah.
Right.
Use a hand.
Yeah, I guess this question, first of all, great panel. Thank you. It's been very informative. My question, I think, would be for Tom, and that is, when you were talking about partnerships, have you had any partnerships, past or present, that are utilizing digital devices?
Well, Novu would be one of those partnerships in which, again, it's a digital experience created by Novu that we then deliver on behalf of our consumers. We're doing, other great examples are around, again, one of the things I've been saying is if you look in the past, the greatest innovation in the world of health has really been around medical science, and it's been the development of what we use to treat and/or diagnose conditions. My guess is that the future innovation will really be around how consumers realize health, because more and more of it, they may not need to leave their home to see their doctor. They may not need to leave their home to scan a rash, which is already existing, or to monitor their adherence. Right now, most of that relationship is also through partnerships for us. So we're not looking to create the device that monitors blood pressure or weight or falls or adherence in the homes. What we are looking to do is to make sure that from a partnership, what we can bring is how do you aggregate the data from all the disparate partners. So if someone's focused over here on this and here, that somehow you can aggregate that data and make it a holistic person and how they're using it from all those different areas. And so other examples of how we're partnering around that digital space.
The question in the back.
Hi, I'm Matthew with Somnowhere. I have a question for Vishal. You mentioned that your score interacts with, it takes input from multiple devices. How do you standardize that input from so many different devices, and how do you validate that the score really, so let's say you're adding a new device into your ecosystem. How do you ensure that the influence of that device is actually really influencing the score correctly?
Sure. So our score was developed by people from MIT and University in Zurich, ETH, and they looked at clinical data, 72 million man-years of data, and how each of these parameters are affecting the lifestyle and the outcomes. And they came up with the algorithm. So the algorithm is actually taking standard inputs. So we take the feeds that we get from different devices, convert them into standard measures, and then use those measures for the score. So it doesn't really vary by what device is giving you the data, except that the variables, how they're affecting, if that makes sense.
Thank you.
I think Jill was trying to wrap it up. So.
Yeah, we want to wrap it up. God, were you guys taking notes? That was amazing. Seriously, great, fantastic. Thank you very much. Lots of good info.
Yeah.